Hi guys, today we're going to be talking about schizophrenia. Schizophrenia is a rather complex mental illness and is not very understood by the general public. So we're going to be talking about the different stigmas associated with it, the diagnoses, the treatments, and causes and risks. So according to the DSM-5, which is the latest diagnostic manual, there are two types of categories for the diagnostic criteria. We have positive symptoms, which are additional experiences that a normal person wouldn't experience. These might include psychotic behaviors such as hallucinations, which are sensory events without environmental input. The most common one is auditory hallucinations, but these hallucinations can also happen within the five senses as well. There are also delusions in terms of psychotic behaviors. These delusions are defined as beliefs that might seem odd to a typical individual. They're also known as basic features of madness in the general public. They are also known as misrepresentations of reality. So an example of this is the grandiose delusion, which is an example of like how a person can think they're on the top of the world. They may believe that they're related to celebrities and so on. There are also persecutory delusions, which are delusions of paranoia, where the person thinks that they're being followed or they could possibly be attacked. There are also somatic delusions, which are a dissociation between the person and their body. They might think that they have a missing limb or they're missing some sort of organ. And those are the three types of misrepresentations of reality. Next, there are negative symptoms, which are a lack of experiences that a normal person would usually experience. Examples of these are avolition or apathy. This is a lack of initiation or persistence. It's also known as a lack of follow-through, such as like difficulty starting a task and finishing it. Additionally, there is allogia, which is the absence of speech or the inability to communicate. There's also anhedonia, which is indifference, lack of pleasure, or positive emotions. And it's also known as affective flattening, which is when you have very little expressed emotion or you're monotoned. There can also be disordered symptoms such as cognitive slippage or word salad, known in colloquial terms. Somebody can also have tangentility with loose associations, where they speak on a tangent on unrelated topics, but there are no associations between those topics. A person can also have disorganized affect or emotion, which means that they might have inappropriate emotional responses to varying situations. This might look like someone at a funeral who is rather laughing than crying. A person can also have atypical motor behavior. This might look like catatonia, which is the act of not being able to move or communicate, sort of frozen in stance. It can also be stupor, which is a state of being like almost unconscious. And the person can also exhibit compulsions, which can look like rocking back and forth. Schizophrenia can also have a very specific onset, and there is a pattern seen in the diagnosed individuals. So typical diagnosis can occur, or most likely occurs, in early childhood and post-puberty. There is late onset diagnoses, which is defined as after 45, but that's not very common. In terms of the onset, there are 4 different stages. So the first stage is the premorbid stage, where it's from birth to pre-puberty, where an individual can experience very few symptoms relating to schizophrenia or no symptoms at all. The second phase is prodromal phase, where it is the part of life after puberty and into the middle 20s. This is the time where a person can be exhibiting schizophrenic symptoms, but they're not necessarily being diagnosed. And then once we get to the onset and progression, this is where most people get diagnosed and have the onset of the deterioration of lifestyle, debilitating symptoms from schizophrenia, and there is a strong progression. And so those symptoms might look like the ones that I mentioned previously, psychotic symptoms, those delusions, hallucinations, negative affect, anhedonia, and so forth. And we really emphasize with schizophrenia that early intervention and recognition of these symptoms is really important because it can help lessen the progression of the illness and make it a little bit less debilitating on your life.
So now we're going to dive a bit into the prevalence of schizophrenia, what these statistics actually look like. Schizophrenia affects 1 in 300 people worldwide, that's less than 1%, and this statistic is similarly low in the US. One thing we want to emphasize and note is that the diagnostic demographics of mental health disorders do matter, and schizophrenia is an example of this. Looking at the lifetime prevalence of self-reported psychotic symptoms, the percentage is highest in the Black American population. About 21.1% of Black Americans report these symptoms, followed by Latino Americans, White Americans, and Asian Americans. Research has also shown that Black Americans are 3 to 4 times more likely than white Americans to receive a schizophrenia diagnosis, and that the former population is more likely to encounter risk factors for developing schizophrenia. But why are these numbers relevant? As we make a point to emphasize, racial bias in mental health care is a significant issue that affects the way people of color, especially Black Americans, are diagnosed, treated, and can also influence whether one seeks help. The racial disparity seen in this diagnosis is just one example of how assessment biases do exist and influence the mental health diagnosis of Black Americans. In terms of causes and risks for the disorder, the exact cause of schizophrenia is unknown, but there are several possible causes or contributing factors. One factor often noted is the genetic factor. An individual is more than 6 times more likely to develop schizophrenia if they have a close relative living with the disorder. Understanding your family's medical and mental health history is really important, and it can even prompt an individual to seek help earlier if they experience symptoms. But while genetics is one of the more commonly noted factors that is associated with the risk of schizophrenia, it's not the only one, and that's actually a pretty common misconception. Several environmental factors have also been noted in contributing to the likelihood of developing schizophrenia, and these can include childhood trauma, substance use, even autoimmune disease and birth complications. Imbalances or changes in an individual's brain chemistry can also be a contributing factor. So a change in the neurotransmitters, which are our brain's chemicals, crucial to how we react to different stimuli, perceive, and communicate, can contribute to schizophrenia symptoms. One phenomenon known as the dopamine hypothesis suggests that a dysregulated system in dopamine transmission can result in symptoms of schizophrenia. So dopamine is a neurotransmitter that causes our neurons to fire. It's often linked to our feelings of pleasure, reward, and motivation. And in certain parts of the brain, there are more dopamine receptors, one of these parts being the mesolimbic pathway. When dopamine binds to these receptors, we see an increase in activity in these areas, and that can result in psychotic symptoms seen in schizophrenia, like the delusions and hallucinations that Christine talked about. Recent research has also added on to these brain chemistry hypotheses and have found that neurotransmitters like serotonin and glutamate also play a role and can affect both the positive and the negative symptoms Christine introduced us to earlier in this presentation. And just as there's no pinpointed cause for schizophrenia, there's also no current known cure for the disorder. But there are, however, different treatment options that an individual living with schizophrenia can use to help manage their symptoms. Antipsychotic medications and dopamine-altering medications are drugs that can help treat psychotic symptoms of schizophrenia. And outside of medications, several therapies are also encouraged for treatment. Cognitive behavioral therapy, or CBT, is a common treatment for many mental illnesses, and it's used to help an individual restructure or train their cognitive pathways, as well as teach them skills in self-monitoring and coping with their symptoms. And a therapy known as CBTP is a cognitive behavior therapy for the symptoms of psychosis. So this form of therapy can be beneficial for those living with schizophrenia because it's adapted to helping these individuals understand psychosis and better react to any delusions or hallucinations in a way that's not harmful to themselves or others. And with these psychotherapies, understanding psychosis in this manner can actually take away a lot of the distressing effects that come with these episodes. Cognitive enhancement therapy, or CET, is a therapy that focuses on social cognition and can actually be helpful in increasing the vocational capabilities for those living with schizophrenia. This method is often used in the rehabilitation of schizophrenia and can improve social interactions for those living with the disorder. Electroconvulsive therapy is another option. It's often used if the individual also lives with depression. And one last and very important aspect of the treatment for one living with schizophrenia is the psychosocial support that they receive. So this can include educating their family and their loved ones about the disorder and the family's involvement in their therapy, as well as improving and rehabilitating some of the factors in their lives that can make activities of daily living difficult. So, now that we've covered some of the major methods of treating schizophrenia, what do the barriers to treatment look like? We often see these barriers shared in many mental health disorders, and one of the most important ones is the stigma of the disorder. The stigma that continues to perpetuate mental illness in general, but also specifically illnesses that involve psychosis, lead to misconceptions by the general population and also cause fear for those who do want to seek help for their disorder. This can influence an individual's willingness to seek help and treatment, and can even influence if they want to learn more about the disorder or educate their loved ones. Note that many of these barriers affect and depend on each other, but one of the most important takeaways for the treatment piece is the significance of an early intervention. So, understanding one's symptoms and seeking help as early as possible can lead to earlier diagnosis and earlier treatment, which combats the barriers of treatment we noted and can also contribute to better treatment outcomes.
So Ali talked a bit about that stigma, and a lot of stigma comes out of and results in these myths and misconceptions surrounding schizophrenia, and we'll talk about just a few today. So one of the most prevalent and harmful myths about schizophrenia is that people with schizophrenia are all violent or dangerous. This is not true. In fact, people with schizophrenia are much more likely to be victims of violence than perpetrators. Another misconception is that schizophrenia involves having multiple personalities. Though individuals with schizophrenia may hear or speak to voices if they're having auditory hallucinations, this is part of having false beliefs and experiences about reality, which Christine spoke to a bit. Multiple personalities is an idea and a component of another condition called dissociative identity disorder, formerly known as multiple personality disorder. And this condition arises from childhood trauma. So, kind of a general distinction is that schizophrenia involves a split from external reality, while DID involves a split in a person's sense of themselves. Another misconception is that if one of your family members has schizophrenia, you will have it too. Ali did talk about this important genetic component to schizophrenia, and this is a major factor. Schizophrenia has an estimated heritability of 79%. But as she also included, there are many environmental and chemical factors also involved in whether or not someone develops schizophrenia. So genetics is not the sole contributing factor. Finally, some people believe that if you have schizophrenia, it's unavoidable that you will end up in the hospital or a psychiatric facility. However, many people with schizophrenia are able to live happy, successful, and fulfilled lives. The key, again, is early intervention, a strong support system, and continued commitment to recovery. Schizophrenia actually doesn't look the same everywhere, so there are cultural factors that play a role in what schizophrenia looks like around the world. For example, different types of symptoms are more common in different cultures. So religious delusions are more common in predominantly Christian societies. Western cultures are more prone to depressive symptoms and delusions about thought insertion or thought removal, which involve a belief that someone else has put thoughts in your head or taken thoughts away from you. This may relate to concepts of individualism in Western culture that make the integrity and ownership of one's own thoughts more valued. There are also cultural differences in auditory hallucinations. One study found that Ghanaian and Indian participants often heard relatives and friends speaking to them in their auditory hallucinations, while Americans generally heard strangers. There can also be variation in what individuals or cultures attribute the cause of their schizophrenia to. In Indian cultures, suffering may be attributed to possible bad deeds of a previous life, a consequence of karma. Vietnamese individuals are more likely to attribute the cause of schizophrenia to an ancestral or family shame, and repercussions of any embarrassing behavior due to their illness symptoms are also regarded as marks of shame for the entire family, ancestors, etc. On the other hand, individuals in Western cultures, such as in the United States, are more likely to attribute their illness to some form of self-failure or weakness. So all of these factors are really important to how we treat these illnesses and how we treat individuals living with schizophrenia that come from different cultures. But how can we provide support and compassion for those with schizophrenia in our communities? And we always want to come back to this theme of compassion. Well, for one, we want to combat stigma. Schizophrenia may be one of the most stigmatized mental health conditions in our society, and as we've mentioned, this can have negative consequences such as individuals not wanting to seek help, escalation of mental health crises with law enforcement, and the disproportionate number of individuals with schizophrenia experiencing homelessness. We've emphasized this in several of our presentations, but it's so important to avoid stigmatizing language, like calling others crazy, schizos, or psycho. It can seem frightening or unsettling to witness someone talking to someone that isn't there or seeing things that aren't real. But try to approach everyone with compassion rather than making assumptions about anyone's substance use, mental health, or prevalence to violence. Additionally, we should consume media with representations of schizophrenia or other mental health conditions responsibly. Media often portrays psychosis and schizophrenia as interchangeable with violence or crime. Remember that this is a distorted picture. People with schizophrenia are up to 14 times more likely to be victims of violence compared to committing violence. And it is estimated that about 11% of the homeless population in the US is living with schizophrenia, even though they are only 1% of the population. This majorly contributes to disability and premature mortality among the U.S. population experiencing homelessness. It's up to us to advocate for more accurate media representation and more resources for people with schizophrenia. Additionally, it's important for us to help loved ones who may be experiencing or living with schizophrenia or its symptoms. So if you do have a loved one who you think or does have schizophrenia, pay attention to their triggers to help them avoid relapse. Practice empathy, listening, and empowering the voices of lived experience with schizophrenia and other mental health conditions. Understand that your loved one may be unable to see that they have schizophrenia. Their entire reality has been affected by their illness. So respond calmly and respectfully and let them know that you just want them to be safe. And provide support with following their treatment plans, whatever that looks like. If you suspect that you may be experiencing symptoms of schizophrenia, see a healthcare professional. Several mental health conditions can appear similar. There are multiple physical and psychiatric conditions that include psychosis and similar symptoms. Seeing a healthcare provider as soon as possible is vital to getting the help that you deserve. Additionally, it's important to manage stress and sleep, which can both be triggers for symptoms or episodes. Try to avoid drugs and alcohol, as substance use may increase the risk of developing schizophrenia or experiencing episodes of psychosis in some individuals, and can interfere with medications for schizophrenia. Additionally, symptoms of schizophrenia may make one more vulnerable to substance use disorders. And above all, it's so important to maintain those connections. Having friends and family involved in your treatment plan can go a long way towards recovery. Also consider joining a support group to support yourself and surround yourself with people who better understand your experience. We've provided a link to find a NAMI support group near you in the description. Here are resources for today's presentation, and thank you all for listening.